So my name is Yvette Harris. Welcome this evening to the COVID-19 Mental Health and Wellness Community Day event that is taking place in beautiful Little Haiti. We are coming to you live on Facebook, so hello Facebook, at the Little Haiti Cultural Center, Caribbean Marketplace. So if you ever get an opportunity to come visit, make sure that you come and support the location. So we're excited. We have an illustrious panel of expertise that are going to help guide us through mental health and wellness, giving some coping mechanisms, techniques, sharing valuable information, and we're really, really excited. So I want to introduce, behind every vision is a visionary person, Mr. Ruben Roberts. He's the former NAACP Miami chapter president. He is the founder and CEO of RER Consulting, and has decided to take this journey into the Miami-Dade County, making sure that the communities have information, resources. We're partnering with Miami-Dade County, who will introduce a representative from the mayor's office who's here with us today, New Horizon, and other different partners that are joining us through this journey. Ruben is a key member of the community. And without further ado, Mr. Roberts, go on up.
Thank you, everyone. Thank you all for attending today. Today is a very special day in terms of us speaking to mental health. This is Mental Health Awareness Month. In addition to that, this is also Haitian Heritage Month, and this is why we chose this location to be here today to speak to this issue in this community. One of the things about our program, the COVID Mental Health and Wellness Program, is that we pride ourselves on being culturally and linguistically competent. So we want to make sure that we are speaking to all cultures in South Florida, not leaving any particular culture out, making sure that we help people understand the importance of going to a path of wellness. When we hear about mental health, a lot of times we hear about the stigma, we hear about the negative parts of it, but we don't hear about path to wellness. What do you do to actually get yourself to a place to where you can address some of your concerns in a proactive way? You're going to hear that today because we have professionals here who have years of experience and exposure to just how to deal with different issues. The folks that we have on this panel will definitely, they are definitely impressive. So I want to make sure that you all enjoy this, make sure that you get some information out of it. This is our goal. The goal is to really get a better understanding of some of the mental diagnosis, and then also the path to wellness. What do we do to make sure that we move towards a path to wellness? With that being said, today we have a representative from the Miami-Dade County Mayor's Office, Susan Holtzman, and we want to make sure, all of these Susans, that we are so grateful for the mayor for supporting our project and also having a representative here to speak on her behalf. Susan?
Thanks so much, Ruben, and thanks, Yvonne, and thank you all for being here, and all of the panelists. I hate standing here with my back to you, sorry. My name is Susan Holtzman, and I am the Mayor's Older Adult and Special Needs Advocate, and that includes mental health and disabilities. And this is the first time that the Mayor's Office has had a mental health advocate. I take this very seriously, although I'm not an expert on mental health by training. My lived experience, I have a great deal of experience with mental health issues, addiction issues, as well as learning to address these issues of emotional wellness, as Ruben was talking about, so that we can keep ourselves well, so that when something like COVID comes along, which hopefully will never happen again, but we never know what's going to happen, there's trauma in our society all the time, that we can be resilient and ready personally for these issues. So we're so excited to be partnering with RER. There is also access to a survey that we would ask everyone take this survey. The information you provide on that survey is going to help direct us in the county where best to provide services to you. So I'm excited to be here and learn with all of you. Thank you.
Thank you so much. And Susan's right on point. I didn't mention anything about the survey. She caught that right away. So yes, make sure that you take the survey. We have the survey at our sign-in desk. And also make sure that you sign into the event. It's very important that you sign into the event. The survey is going to really help in terms of how we can address some of the concerns that come up from that survey. We want to make sure that you guys are participating. You have to be 18 years and older, and you have to be a Miami-Dade resident to complete the survey. All right? Yvette?
Okay, so we are going to introduce our wonderful panel. I'm sure you're going to be extremely informed. They come with a long list of impressive qualifications, and they're the ones that are on the front line actually doing the work on a daily basis. So I'm pretty certain that we're going to learn a lot from them. To my right over here, Majorie Lozama, who is a board-certified psychiatric mental health nurse practitioner. She received her postmaster's certificate from FIU, Florida International University. Her love for learning and determination to assist those affected by mental illness led her to further her education in this field. She recognizes that the mental health disparities, especially amongst minority populations, resulting from numerous environmental and socio-economical factors, and she's working to kind of make sure that we bridge that gap. She is one of our moderators. To my left, we have Dr. Guerda, who just came in from UM. It was a graduation that took place today, so we're grateful for your presence. She obtained her doctoral degree in clinical psychology from Boston University. She completed her pre-doctoral training at Columbia University Medical Center, her post-doctoral training at the New York State Psychiatric Institute, Columbia University Department of Child Psychiatry. So she will also give us some additional information as they introduce the illustrious panel.
Yes, thank you so much. So we say good afternoon, Oner, because you are here at the Little Haiti Cultural Center. So we always greet everyone. Whenever we start anything, we say Oner. Respect. And then everybody usually say respect. So it means that we are here to honor, and then the response is respect, because we also will be respectful of each other, right? So that is our custom as Haitians. I am incredibly excited and thrilled to be here for a conversation regarding mental health, right? Not mental illness, we're gonna get to that as well, but to really speak about mental wellness today. So thank you so much for being with us, and thank you for the invitation for us to be together. Super excited to always do anything with my dear sister friend Majorie Lozama with me, as well as we are moderating this particular session this afternoon. So with that, we're just going to ask the panel to just introduce themselves very quickly, so that way you get a chance to know who they are. So the team of experts that we have on this panel with all of us here today. So if you guys all agree, women first? Okay, great.
Hi, my name is Nzingah. I'm a Haitian American holistic wellness consultant, as well as yoga teacher and teaching artist, where I integrate the arts as a way to help children and adults heal.
Hi, I am Yanatha Spikes. I'm the founder and executive director of the Affirming Center. I'm a clinical mental health counselor, and right now doctoral candidate in social work.
My name is Caesar. I'm with Power Center for Social Change, where we help fight the social injustices that happen in the school system.
Good evening, my name is Gene Avillard. I'm the director of the homeless department at New Horizons, and I've been with New Horizons for 35 years, and I believe this is our 50th year servicing the community. So welcome, and thank you for having me.
Wow, so we said it, right? We told you that we have a team of experts here with us this afternoon for this conversation, and really, really excited to have all of you with us. Thank you for being here, and thank you for everything that you do as well. So we know that one of the reasons why this conversation today is so important is because talking about mental health, right, is oftentimes not the thing we want to do. So today we're going to start that conversation by talking a little bit about the importance of making that distinction between mental illness and mental health, right? Because oftentimes when we say we're going to do a session on mental health, the first thing you get is all the mental illness problem, right? And then we wonder, why is it that people don't want to talk about mental health? Because they come in and we say, well, you have all these problems, right? And so this is one of the reasons why focusing on mental health is important, because it means today we get a chance to not only address the issues, but we also get a chance to talk about the things that puts us on our path for wellness, right? The things that we can do to actually prevent us from even having chronic mental illness as well. Right, Majorie?
Correct, yeah. Yes. And then we know that the past 2 years has been very, very, very difficult and hard on our mental health. And so we are here, and then we're going to give you a chance to really talk to us about the past 2 years and the impact, especially in our Haitian community and also in our Black community, minority community, since we're focusing on that today. So because COVID-19 was brutal, even all of us knew somebody, a family member. I lost my brother to COVID at the beginning of COVID, so it was especially hard on my family. So each one of us knows someone who had COVID or lost a loved one of COVID or grieving from COVID, from losing jobs, and the impact of COVID on our community. So we're going to start on talking about what is the impact of COVID on our mental health. If we want to start, Jean?
Thank you. I think I would like to start by giving you a definition of what mental health is. And this is the World Health Organization definition of mental health. It's a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stress of life, can work productively, and is able to make a contribution to his or her community. And as a social worker, of course, I want to focus on the coping with stress. Okay? And I believe one of the issues that we have is that as a community, we have long-standing inequities, economic inequities and health inequities. And what COVID has done to us basically is exacerbate all of those inequities. And I think this is the basis for us to be here. We want to talk a little bit about what those things are and how we can cope and hopefully live a normal and better life.
So we know very well that during the midst of the pandemic that the impact on our youth was significant, right? So maybe Davis, you can talk a little bit about from your perspective in the midst of COVID, right? What are some of the things that you noticed in terms of the impact?
Some of the things that I've seen that impacted me, like personally, during COVID, because I had COVID, there was a point in time where I couldn't taste anything or I couldn't smell anything. And on top of that, I had school and I had to get online class. I was doing online classes from 8 a.m. to 3 p.m. And I couldn't really focus because my head was hurting and, I needed just something to I needed medicine or my mom would make me tea. So
that specialty.
Yeah,
that specialty.
Yeah, that ginger tea. And, it was really hard, focusing on my schoolwork. And on top of that, I had to stay on Zoom for 8 hours and, try to focus. So, and I wanted to speak about those issues with my counselor, but my counselor was so overworked because it's COVID and she's online and she has a bunch of other students to attend to. It was really difficult because I just felt unsupported.
Wow. Nicely done, right? Nicely done, right? Not only did you have to be able to talk about the distinction, right? Many, I'm sure, a lot of people who are watching and seeing this, and some of us here also were dealing with COVID, right, in the midst of all of that. And then on top of that, you had virtual schooling, right, to be on a square, to deal with that, and not being connected to your friends, right, your colleagues, being outside of the home for a little bit of time as well. All of that, right, is important to, as we're thinking about the impact of COVID, it's so important that we think about all of those things. So really, really great. Wonderful points. Yeah. Jonathan, what did you want to add?
Well, COVID presented itself with a lot of changes for me. My mom was diagnosed. She was in a hospital in Georgia. So I had to uproot my life, and I went and stayed in a hotel for 6 weeks because it seemed like every time I thought I was going to be able to come home, they thought something else was going to happen. But thankfully, she made it through it. And but it took a lot to understand what it was and to get some sense of normalcy about the significant changes that had to happen in order to respond to her. And that was all well and good, but then when I got COVID, I was in the middle of a semester, and it was difficult to stay focused. You know, you're trying to do work, and your brain and your senses and everything just go on vacation for a little bit, and so it was quite challenging. But you know, some way, somehow, we made it through it through the process of time. One of the things to get better sooner than it probably wanted to happen naturally, but we did get through it.
So important. This is why we're having this conversation, because when we're talking about the impact of COVID, these things don't oftentimes get talked about, right? Because now you're talking about being a professional, being in school, right? And at the same time, you have family members to take care of, right? And so when mom is sick, we have to show up, right? You've got to do what you need to do, and that also adds another layer, another factor to everything as well. So thank you for bringing that into the conversation.
All right, and then Nzingah, I know that you were very busy during that time with what you do. Can you share with us?
Yeah, so I will definitely say, personally, I was overwhelmed because in the field that I work in, I was working with children, and I moved from working with children in person to working with them online, and some of the contracts that I got were with a mental health facility for children because they weren't thriving because of the isolation. So one of the things I saw a lot of people struggling with was isolation, particularly children. And a lot of times we talk about how it was so hard for adults to cope with that isolation, but children really didn't have that space to even process. And particularly those children I was working at that facility, they were in that facility 24/7, and they were no longer able to get visits. And so that really impacted how they were thriving. And I can even actually, now that I think about it, my mom suffers from mental illness, and at the top of COVID, she became institutionalized. And because that isolation also happened for her, and the impact we usually see with her having a moment where she would go into a ward where she would come out okay, instead she actually got worse because she wasn't able to have that external contact, so much so that she had to be released, and that's where we started to see her thrive again. So I think isolation and being overwhelmed was what a lot of people felt at that time, and just uncertainty. And I think we still struggle with uncertainty, and that brings a lot of anxiety because we're not sure what tomorrow holds.
So, we can add something?
No, I was just going to say that that's what COVID has done to us. It has taken our financial ability to provide for our families. It has taken our ability to relate to others, including our loved ones. It has taken away our ability to deal with stress, to cope with stress. And I was taught that when something is taken out, the best way to cope with it is to do something to fill that gap. And I think that's what we're going to talk about today.
Yeah.
What we can do to fill that gap that COVID has taken away from us.
Right, absolutely. So just in case you're coming in late and joining us for this conversation, let me just recap what are some of the key things that I think you just absolutely heard, right? And I'm sure that all of us here can resonate with that, and those who are watching can really kind of feel that as well, that COVID in the midst, and we're gonna leave there because we dealt with a couple pandemics, right? And so it wasn't just COVID pandemic, because we're also dealing with racism pandemic at a national level, right, as well, which would be important for us to really be able to talk as well. But some of the things you all just mentioned, okay, I'm just keeping notes for all of you who are watching, who may have gone to sleep just a little, right? So some of the things you heard about in terms of impact, right? So we heard about depression, we heard about anxiety, right? But why don't you talk about the grief, right? So what does it mean for you to lose someone, but you can't participate in the natural funeral process, right? The things that absolutely leads to closure. So that's also important. We heard a little bit about the isolation, right? Having COVID yourself, dealing with family issues, you brought in financial hardship, right? On top of that. So we're just talking about compound of issues, right? That absolutely was about, and I'm sure, we also heard increased drinking, increased domestic violence also was a big part of COVID, during COVID, increased sexual, right, abuse, right, as well in the midst of that. So just to say there is a lot of different things, and it's important that we are paying attention and listening to one another, because your experience could be very different from your experience, right? And so how do we create this space for that? Really just awesome. You guys got us going nicely,
I know.
right?
Exciting.
Yeah.